On all fronts, healthcare systems are on the front lines of climate change. The health sector has an important role to play in both mitigating climate change through the adaptation of low-carbon strategies and building resilience to climate impact. Worldwide, governments have been slow to embrace climate-smart health agendas due to the lack of funding support. It is disturbing to see that less than 1% of international climate finance has been allocated to support health projects. The health sector has been largely excluded from these financings, with health and health systems disconnected from the major instruments of global climate action. This global trend truly reflects the reality in our country. According to the Global Climate Risk Index, Vietnam ranked 13th among the economies most affected by climate change between 2000 and 2019. The health and economic crisis caused by COVID-19 is worsening existing vulnerabilities and driving up the cost of climate action. In 2018, Vietnam approved the National Action Plan for Responding to Climate Change of Health Sector, period 2019 to 2030 and Vision to 2050. However, the implementation of this plan has some challenges due to limited allocation of budget. The Ministry of Health has taken strong effort to integrate the plan activities to regular health tasks and relevant existing programs, and mobilize technical and financial support from stakeholders. For example, the Ministry of Health is piloting climate-resilient water, sanitation, and hygiene in healthcare facility models in collaboration with WHO. The Ministry of Health also is one of implementing agencies to implement the GCF-funded project, Vietnam National Adaptation Plan Development and Operationalization Support, which is chaired by the Ministry of Natural Resources and Environment. However, many areas in the National Action Plan of the health sector need to be mainstreamed into the above-mentioned National Adaptation Plan with the sufficient allocation of the funding resource. Here at COP26, I am calling on nations, multilateral and bilateral agencies, NGOs and private sector to discuss the long-term climate regime during the 2020 to 2025 transition, taking into account the needs and priorities of health sector and facilitating access to climate finance for climate-smart healthcare. Secondly, it is important to go beyond the formal health sector and address the determinants of health, such as clean and reliable energy, water and sanitation services, and food security. Ministry of Health in Vietnam and Ministry of Planning and Investment, together with other line ministries, international partners, including UNDP and WHO, and NGOs such as FHI 360, are planning to test new methods for assessing climate finance for climate-smart healthcare, build and contribute to the global evidence base of what works. Thank you.